Hi there. Hi everyone. Welcome to this week's live Physio Q&A. Welcome on all the different channels. So welcome on Facebook, on Twitter, Instagram, and YouTube. Today I'm going to be answering all of your questions on pain, injury, training, you name it. So please do ask away. So last week I had a lot of questions and we ended up having quite a long Q&A session. So we'll see how we go today. Before I start answering people's questions, please could you just let me know that you can hear me loud and clear. So if you're watching, excellent. Hi Alan, great. Yeah, I'm good, thank you. How are you? Could you just let me know, Alan, that you can hear me and see me, and the tech side of things is all good. And then please do all start asking your questions. As I say, last week was a busy week, so I am excited to hear what questions you have for me today. So if you have any questions about any kind of pain or injury or recovery from from long COVID, that sort of thing, please do just ask and I will answer. So as usual, I will be referring to exercises that you can access for free on our website. So if you go to www.octopusclinic.com, you'll find the exercises there. And as ever, it's really important that you bear in mind that obviously the advice that I'm giving you today is likely to be based on a relatively small amount of information. So it's much better if you can have a consultation with a physio. And of course, we do video consults. So if you want to find out more about video consultations, then please do go and check out all the reviews that we have on Facebook and on Google Maps. We've got over 300 5-star reviews, so please do go and check those out. I can see that people are joining slowly but surely. So just to introduce myself to those of you that have never met me before, my name's Lucy McDonald. I'm a physiotherapist. I've been a physio for over 20 years now. And I'm here today to answer any questions that you have about your pain, injuries, training, etc. Now, Alan, last week, as I know that I can see that you've put some messages in there already. Last week, I left your question to the very last. So do you have any questions today based on perhaps some of the things that I suggested you tried out when we met virtually last week? Any sort of feedback or any further questions that you might have right now while we're waiting for others to join, please do just shout. So if you're looking for, so I get lots of questions every week, lots from runners or people just in pain or injured. And if you or any of your friends, family, running buddies, if you have, if you do want to sort of look into some top tips on how to prevent injury and how to manage injuries, then please do go and check out our YouTube channel. So if you go and have a look, there are playlists on all different things, ranging from long COVID to knee pain in runners to back pain, etc. So do go and check that out. But on the website, you'll also see there's a search tool at the top. And if you just tap in whatever you're interested in, it will come up with the topic that you're looking for. So one of the things that I always recommend that people do is go and look at the video. If you go to the website and you put in the word recovery, anyone who's watching this who's either a runner or or training for a particular event or recovering from an injury, so or recovering from pain, I'd strongly recommend that you go and have a look at that video. And in that video, I talk about how to optimize your nutrition, how to optimize your stress management, your sleep, lots of really practical tips on there. So I think that would be really helpful. And I've also got a video on the top exercises for for runners as well. So that's another really common question I get asked, which I think is helpful. So the top exercises for runners, whether it's strength and conditioning training, alignment work, stretches, etc. So our first question has come in, and I'll just bring it up on the screen here. So let me have a little read of it first. What are the best exercises or stretches for a knee that locks up when sitting? It doesn't always straighten fully and clicks when straightened. Okay, so thanks very much for joining and for asking that question. So knees locking, it depends what you mean by locking, and it's really useful if you can give me some feedback on some of these things as I'm asking them, Kath. So knees locking, the classic thing that springs to mind is a meniscal injury. Now let me get my knee here. I'm not sure if you've ever seen someone to diagnose what's going on in your knee, Kath, but I would really recommend it. Now, it depends whether it's what we would call true locking, and that it's just literally getting stuck in a position and then it's really, really hard to move it at all. Now, if your knee is stuck in a bent position, you really do need to go and get it checked out immediately. I wouldn't wait some days or weeks. If it's literally just stuck in one position, you need to go and get it checked. But presuming, it sounds to me like it's more like the kind of locking that gets really stiff and then you kind of have to slowly straighten your leg up. Just if you could confirm that it's not completely well, you just say it doesn't always straighten fully. Basically, can you just tell me, Kath, if you have full range of motion, if you are actually able to straighten your knee fully? That's quite useful, because basically inside the knee joint, if we open up the knee here and just open up it inside, you can see that for some bizarre reason on this model, the menisci, so two meniscus, or we call them menisci, they sit on the bottom part of the knee. So they sit on the tibia there. And sometimes what can happen is you can get a tear in the meniscus, in one of the meniscus, that then flips over and locks your knee. So that it then makes it impossible for you to straighten your knee. And in that case, you do need to see a knee surgeon. So to get it addressed from a surgical perspective, if it's sort of flipped over and then just stuck. If you don't have full range of motion, if you're not able to restore full range of motion, then you can lose that range of motion. So you can get what we call a fixed flexion deformity, which is quite a challenge to overcome. It's possible, but it is challenging. So the sooner you can get a fixed knee sorted, the better. Okay, great. So you've said, good, you can straighten your knee almost fully, and it's not stuck, it's just a bit stiff. Okay, so in which case it could still be the meniscus, but it doesn't sound to me like it's an emergency situation. But just bear in mind what I've just mentioned around that. It's really important that you try and regain full knee extension, so fully straightening your knee, because as I say, the structure at the back of the knee can get a bit tight, and then it can get really difficult to restore that full range of motion. So, however, it's possible that is there some swelling in your knee? Could you tell me, Kath, if there's any swelling in your knee? Because if there's swelling in the knee, you might find that it's difficult to fully straighten it. So the cause is therefore alongside so if you can run and walk fine, that's great. So it's unlikely that if you can run and walk with no probs, it's highly unlikely that it's going to be either the cartilage or the meniscus inside there. And it's more likely probably that it's to do with the kneecap. Now, presuming that you haven't, and another question, Kath, whereabouts is the pain when you feel it? Is it by any chance around the front of the knee? It sounds to me like it might be to do with your kneecap joint, rather than, so you've got your kneecap joint at the front of the knee here, and then obviously underneath that you've got your actual knee joint itself. And it's quite common if you've been sitting for a long period of time with your knee flex, it's quite common for it to then be quite difficult to straighten after you've been in a prolonged position. So it would be useful to know, is it painful up or downstairs? When did it come on, etc., so that I can kind of get to the bottom of a bit more what's going on. With kneecap problems and also with knee tendon problems, it's often worse going downstairs rather than upstairs. Not always, but often it is. So that's quite a helpful diagnostic little bit of information for me. And also it'd be good to hear kind of how it came on. We always want to try and establish a mechanical cause. So in other words, if you suddenly increase the amount of running you were doing, or you were squatting down in a deep squatting position, doing some gardening or something like that triggered it, that's really helpful, because if pain just comes on for no apparent reason, then that can start to make us think you really do need to get that sort of thing checked out. Likewise, if you have pain at night, often inflammatory pain is worse at night. So by that, what I mean is, if you've had an injury in the day, then it'll be worse for the next couple of nights. But if it's painful every night consistently for a prolonged period of time, then you really do need to get it checked out. If it lasts more than a couple of weeks, then you do need to please get it checked out. Now, as you may know, we do video consultations. All of the consultations, or the vast majority that I do are by video consult, which means that geography is no option, no barrier, which is great. So please do get in touch. And if you want to know about what a video consult with a physio involves, then go and check out the reviews on Facebook, and also on Google Maps for Octopus Clinic, and you'll see that, and I don't have to bang on about it. Okay, so interesting. Yes, there was a particular event that caused the knee pain. So you sat awkwardly, which caused a weakness that became an injury. Okay, so it's most likely that you've done, without doing a video consult, I can't tell you exactly what structure it is, because as you can see in the knee, even just with the kneecap itself, as you can see, this poor plastic model has the kneecap's fallen out. But normally there's a kneecap that sits in that tendon there, and then that kneecap moves up and down inside the groove inside the femur there, and then this is covered with cartilage. The underside of the kneecap is covered in cartilage, and then you've got all sorts of soft tissues around here, things that we call, fancy names like retinaculum and fat pads. That's not such a fancy name, is it? So you can have pain or irritation of any of those structures, and as I say, asking you quite a lot more questions that would probably be a bit difficult to do right now would enable me to narrow down which particular structures are sore, are causing your pain. So in the meantime, I do need to advise you not to do anything that's painful. Now, often when I'm seeing patients and I've done a full assessment and diagnosis, I will advise people to do things that are uncomfortable or painful. But because I haven't seen you, I need to obviously get a diagnosis first before I can do that. So in the meantime, please don't do anything that's painful. But as and when, it would be good for you to strengthen your knee. So generally, irrespective of what structures are involved around knee pain, it's a good idea to strengthen your knee. And it's a good idea to strengthen the main muscle groups that pass over the knee. So your quads muscles, which are the muscles at the front of the thigh, your hamstring muscles at the back, and your calf muscles. So one of your calf muscles, your gastrocnemius, runs and inserts above your knee. So those three main muscle groups, but then also things like the function of your glutes muscles, so your hip muscles, those have a really significant effect on the function of your knee, and likewise with the foot. So presuming none of these exercises are painful for you, Kath, I would recommend that you do some heel raises. So if you have a look on the website and do video number 42, just to make sure you're getting the range of motion right in your ankle, and then also some nice squats. And the good thing about squats is that you can modify them to make sure, as I say, they're not painful, but that will get those quads muscles activating. And then hamstring strength work as well, and as I say, glutes too. So please do go and take a look on the website, but just it would be great if either me or my team could see you for a video consult. So hopefully that's helpful. Let me know, Kath, if there's any other questions that you have. Anyone else who's watching, please do ask any questions that you have. Everyone's being terribly quiet today. Last week I was absolutely inundated with, I think it was about 40 or 50 questions last week. So maybe the good weather means that people are not feeling pain or getting injured quite so much. Who knows? But please do ask me any questions that you have. Those of you that are watching live at the moment, that would be great. So one of the things that's popped up in your question there, Kath, is exercises or stretches. Now, you might be surprised that I've talked a lot about strengthening the knee rather than stretching it. And what we now know is that actually to regain movement, you're much better off doing strengthening exercises rather than passive stretching. So, you know, the kind of thing where you, I don't know if it's a quad stretch, you take your heel to your bum and you hold it for 30 seconds, or hamstring stretch where you stretch your leg out in front of you, stick your bottom out so that you're getting. So we do have all of those stretches on the website, but I would recommend with the vast majority of people that if you're trying to regain movement, that you go for what we call eccentric muscle strengthening. So most people will strengthen a muscle concentrically. The best thing to do is to use the quads muscle as an example. So if you think about your quads muscles, which are the muscles at the front of your thighs, if you're going from a sitting position to a standing position, your quads muscles shorten to enable you to stand up like that. If you then go from a standing position and slowly lower yourself down into a sitting position, your quads muscles are the ones that are controlling that movement from a knee straight position to a knee bent position. Now, if you're lifting your heel to your bum, that's your hamstrings that do that. But if you're going from a knee straightened position and slowly bending down into a more knee bend, so for example, if you're stepping downstairs, that's eccentric muscle strengthening, and that's slowly lengthening the muscle rather than. So it's a form of strengthening exercise rather than a passive stretch. So that's why I've been talking about strength stuff rather than straight up passive stretching. Okay, so I have another question that's come in, and yeah, that's a pleasure, Kath. I'm glad to be of help. So, hi, you helped last week after my question about hamstring injury, but also had tingling in heel. I've been doing the Physio strength exercises for 10 days and my hamstring still hurts. And now also my knee hurts and my backache is worse than usual. So I don't think that you should be I don't think it's your hamstring that's causing your problem, Angela. Oh, let me change the question on the screen. I don't think it is your hamstring that's causing your problem, and I think that you do need to have a consult to have a second opinion. I can't remember off the top of my head whether you're seeing a physio or not, but I would really like to have a second opinion with you. Give a second opinion, please, either with me or one of my team, because it really doesn't sound to me like it's your hamstring. And the thing is because if you remember, for those of you who weren't here last week, so your sciatic nerve comes out from various levels in your back, in your lower back, and then joins together in a big nerve that runs through your buttock, down the back of your leg, and then branches off. So the most common cause of sciatic nerve pain, which is known as sciatica, that's all that sciatica is. It doesn't give you a diagnosis of sort of where exactly the pain is coming from in terms of kind of which disc might be bulging and pushing on a nerve, or irritating a nerve rather. So what it does is it just tells you that you've got pain in your hamstring. So pain along your sciatic nerve. You've seen a physio and they found nothing. Okay, I'd really like to do a second opinion if I may. It sounds to me like as I say, there's definitely some kind of nerve irritation going on, but there's a lot of different things that I would like to ask. So back to this, what I was talking about here. So you can find, and one of the things that I find, people say, oh, I can't understand why my hamstring muscle is still painful. And then when we do some nerve tests, it transpires that actually there is this sciatic nerve involvement. Now, the management of pain that's caused by the sciatic nerve compared to pain that's caused by a hamstring tendon or muscle is really different. So, for example, with a hamstring tendinopathy, so where the hamstring attaches in the bottom here, in that bum bone, it's all about loading it and progressively and doing quite high repetition, can be quite uncomfortable exercises, and then that will then enable that tendon or muscle to recover. However, if you do that and you're quite aggressive, for want of a better way of putting it, if you do too much with a sciatic nerve problem, then you're going to flare it up and make it worse. It sounds to me like that's where you're at the moment. So it sounds to me like because when you contract your hamstring muscle, you also squeeze the nerve that runs through those muscles. That could be irritating it. And depending on how you're doing the exercises, I'm not sure what exercises you're doing, but depending on how you're doing them, I certainly would absolutely avoid hamstring stretches in your case. Absolutely. And it will be a matter of gently mobilizing the nerve, and particularly strengthening more around your back and your hip musculature. But we would have to be careful with not, again, because your sciatic nerve runs straight through your glutes or straight next to your glutes, you need to be really careful not to do tons of glute stuff, because again, that can cause some more irritation of the nerve. So just a few things that I need to run by you, just in case we don't have a virtual consult, which, as I say, would be great. It's because it sounds like it might well be coming from your back. There are a few things I need to run through. So the following things are signs of that you need to go and see a doctor immediately. So if you have any bladder or bowel problems, so particularly releasing the fluid from your bladder or controlling your bowel, and any reduced sensation, particularly in your inner thighs, in what we call the saddle area. So I'm presuming that if you've seen a physio, they will have run through those questions with you, but they're super important things. Also, if you have any problems with kind of weakness or coordination, that sort of thing, it's really important to go and see a doctor immediately. However, the pain itself and the tingling that you mention, they are not indicators of severe damage, which I know sounds a bit odd. And sometimes people can be in excruciating pain, but that doesn't mean by damage, I mean, it doesn't mean that what you're experiencing is something that won't go away with the right exercises, with time, and with the right approach. So I'm glad that they ruled out all those questions. That's good. So as I say, probably what we need to do is we need to look at all the different aspects of your life that are contributing to your pain. Okay, so I don't know what your job is, but perhaps, for example, if your job involved a lot of sort of repetitive bending, that doesn't mean that that's bad for your back, full stop, but it might be that short term we just need to reduce that down a little bit and then strengthen up the muscles that enable you to do those movements. So your back is designed to bend and twist and do everything that we want to do with it, but it needs to be done with the right muscle strength. So you're sitting behind a desk all day, so probably strength is going to be something that you need to be working on, unfortunately, because so many of us have sedentary jobs. We do need to address those things. The most likely place, and this is obviously a bit of a leap of faith here because I haven't done an assessment on you, the most likely thing is that you do have some kind of irritation of a nerve as a result of a disc bulge. You can see on this model, they're always a bit dramatic, the way that they're portrayed on these plastic. So this is a plastic model of the spine. You can see there that little red blob. That's supposed to demonstrate a disc bulge, which is, anyway, and what can happen is you can just get, not necessarily, a lot of people think, oh, if they've got a disc bulge, it means that the disc is sort of pushing on the nerve. And that sounds like that's highly unlikely with you. And in most cases, it isn't the case. You may have noticed, Angela, that there's a fluctuation in the pain, depending on your position, depending on time of day, what you've been doing, etc. And that will be because what happens is with the disc bulge, you get some inflammation in the area, and that can just irritate the nerve that sends the pain down the leg. But then, of course, because it's fluid, it can vary very, very rapidly. So it would be great to see you. I'm trying to think of other things that I can advise you while we're here. But if you weren't here right at the beginning of the session, please do go and look at the video. So if you go to the website, octopusclinic.com, and you go into the search tool, and it says, and you put the word recovery, no, not recovery, put the word recover, you'll get a video that basically talks through all the different things that you can do to help your recovery, irrespective of the injury. So making sure, like, tips on how to optimize your nutrition, tips on how to manage stress, get decent sleep, because all of those things, as I say, irrespective of the diagnosis, all of those things will help recovery, and they are all within your powers. I'm not sure if you're sleeping at the moment, are you, Angela? Can you let me know? And that's my pleasure. Because sleep is a really fundamental part of the recovery process. But hopefully that's been helpful. Okie doke. So we're coming up to half an hour. If anyone else is wanting to ask questions, I know there's always a bit of a delay and some people join a bit later. But I can see that there's plenty of you watching. So please do ask me any questions that you have about pain, injury, training, you name it, and I will endeavour to answer it. Great news that you sleep well, Angela. That will help your recovery. Although I do think that you've had your pain for a while now. Please, can I see you? So yeah. So anyone else that has any questions, please do let me know. Otherwise, I might actually, it's quite sunny down here in London. I might wrap up early today. So I will, this week, because I was a bit overloaded with questions last week, I didn't share too much on social media. So please do, I will do next week, but please do share with your family, your friends. The more, the merrier. It's your chance, their chance to ask any questions about pain or injury. I know it can be difficult getting this kind of advice at the moment, so please do get in touch. If you do want an appointment, the best thing to do is to contact reception@octopusclinic.com. But I hope that that's been an interesting session today about the knee and the lower back. So I'm going to give it sort of the final gong, as it were, in a minute. If anyone has any questions, please do write them now, or forever hold your peace. Or not quite forever hold your peace. You can ask me next week if you haven't plucked up the courage to ask me today. And there we are, running in at the just before I hit the gong. Okay, here's the question. So I started running last year and then stopped for a few months because my right foot hurts on the top right. Let me get my foot. So again, this is a plastic model of the foot in case anyone's going to get squeamish on me. So I started running last year and then stopped for a few months because my right foot hurts on the top right. It's 3 fingers away from the ankle bone. Sorry, it's the only way I can explain it. Natalie, could you tell me, is it still painful even though you've stopped running? And is it painful over the bone So is it painful when you poke that bit of your foot, is it painful over the bone? Like, can you find the bit of bone and then poke it? And is that sore, or does it feel like it's more like one of the tendons that you can twang in that area? If you give me a little bit more information, that would be brilliant. Okay, so while you're just responding to those questions of mine, Natalie, what I would say is that with the feet and with runners, we do need to always bear in mind that there is a possibility, a low risk, but it is possible that foot pain can be caused by stress fractures. Now, as I say, it's far, far more likely that there's a problem with the soft tissue, for example, with a tendon or with a ligament. But it is possible, and especially, as I say, if you can poke the bone and the bone feels tender to touch, and particularly if it's a localized area, then there might be a stress fracture. Now, before a stress fracture, you get bony bruising, so sort of a stress response. Well, depending on how quickly it's come on anyway. So that's something I would bear in mind whenever I'm assessing someone who's got pain in the foot and has done a lot of running. Now, I'm not sure what program you started with, Natalie, when you started your running. I am a fan of the NHS Couch to 5K program. I think it's a brilliant program. The reason being is that it's really nice and steady, and it builds things up in really small increments and gives some nice guidance. So for anyone who's watching who's not sure how to get into running, or if you've been injured for a while and you want to get back to running having not run for a while, the first thing is I'd make sure that you can walk briskly for 45 minutes before even considering doing any kind of running. And as long as it's pain-free when you're walking briskly for 45 minutes, then you can then progress onto a couch to 5K type program. You're always better off going slowly. So the process of getting fitter involves a little bit of microtrauma to the tissue. So in other words, you actually do break some of the fibers of the soft tissues. You create that microtrauma, and then the body responds by creating more cells, stronger cells, more resilient cells. So that's the process of getting fitter. Now, the process of getting fitter like that relies on a couple of things. So it relies on a number of ingredients that enable that amazing adaptation recovery process to take place. So first of all, you need time. Now, if you're not allowing your body time to recover, repair, then you're just going to get cumulative load. You're going to get more and more and more microtrauma, and then that will create potentially an injury. The second thing is that you need to have decent nutrition. So you need to make sure that you're eating all the right things so that your body can create those new cells, better cells. And also you need to sleep and have decent stress management, because without those things, it's more difficult for your body to repair. So please do, I don't know how long you've been watching this, Natalie, but go to the website, stick the word recover in the top, and you'll get the video that talks through all that stuff in detail. So it sounds, you've just messaged me saying, yes, I started with Couch to 5K, and you think it's a muscle, not the bone. So bones don't necessarily behave in the way that you'd think. A lot of people think, oh, well, if I had a stress fracture, it would be super, super painful. I wouldn't be able to do anything. But it's great that when you poke around there that you can't feel it over the bone. That's really encouraging. But we still do need to bear that in mind. And unless I've assessed you, I can't rule it out. So what we need to then do is work out, okay, so it sounds like from what you're saying, it might be a tendon in the top of the foot there. So tendons respond really well to a progressive loading program, but I can't get you to start on a progressive loading program until I've absolutely ruled out any bony damage. Because if you load an area of bone that's bruised or has a stress fracture, then it can develop into much more severe issues. So, but yes, so that's the response to the tendon. Now, we've talked a lot about that local part of your foot, so whether it's bone, tendon, etc. But what we haven't talked about is what's going on that's creating an excessive load in that particular part of your body. Because that process that I was talking about before should happen throughout your body. So you should get that sort of low level achiness. That's a sign that micro trauma adaptation repair process is taking place. But if you're getting one localized bit, then it sounds to me like there's something about your biomechanics. So something about the way that you're landing on your leg that is putting particular amounts of load through that part of your foot. So what I would look at, and what I would suggest that you look at, is you look at your whole biomechanics. In other words, look at the Running Man exercise. So go onto the website and stick Running Man on the top there, and it will come up. So do that exercise. And then, presuming it's pain-free, you can do that and make the adjustments depending on what you find. Make sure you do it in front of the mirror, wearing your shorts, and then you can look at your foot and your knee and your hip alignment and see what might be creating excess load through that part of your foot. Then what I would look at is your foot posture itself. So do you have quite flat feet? Do you have quite high arches? If you have one or the other will depend on which exercise I would recommend. If you have particularly flat feet, then you can go and have a look at the website where if you go to the foot and ankle section, you'll see on the thumbnail there's an exercise where the person's standing with their with a band around their ankles, and then they're working on creating the arches in their foot and stretching the arches in the foot. So you have flat feet. So that exercise would be really good for you. It must be pain-free for fear of sticking on the same record, but yeah, it must be pain-free. So go and have a look on there. I can't remember what number it is, but if you navigate through to the video exercises on the website, you'll see on there's an exercise. You'll see there's a picture with a TheraBand around the ankles where you can learn to train the arches of your foot. And then also look at, as I say, the Running Man, but also often with flat feet, there's also some instability around the outer hip muscle. So I would also look at the wall ball series as well. And last but not least, look at exercise 42, which talks about the alignment going up onto your tiptoes. But it would be great to see you. So please do get in touch and we can do a video consult and I can give you more specific advice. But hopefully that's been helpful, Natalie. Right. Anyone else with any questions, please do speak now. Otherwise, I'm going to wrap up quite soon. But I hope that those of you who are still watching and those of you who have been watching have found this useful, irrespective of whether I've answered your injury questions or not. I hope you've picked up some useful tips and hints along the way. Do go and check out our various different social media channels. I tend to be most active on Facebook and but I'm trying my best on the others. That's a pleasure, Natalie. Glad to be helpful. So yes, I think we're going to wrap up. I am going to do a second lift of my going gone gong and waffle away for another 30 seconds or so to give you the chance to write any other questions that you would like to ask. So please do come and join us next week. Please do invite your friends, your family. The more the merrier. And next week I will send out a message in advance to remind people that this is going ahead. Because as I say, last week I was somewhat overwhelmed by the number of questions, whereas this week it's been the other extreme. So maybe I need to just work out a way of getting somewhere in between the two. Your advice, your tips and suggestions for videos that would be useful for you are, as ever, would be appreciated, and I will certainly respond to them. So until next week, unless I can just see someone else, there's a couple of other people joining, type away quickly if you want me to answer a question if you've just joined, because I am about to wrap up. Even though quite a few people have just, I can see from the numbers just jumping up. So maybe some people are suddenly realising that this is going ahead. Ask any questions that you have about pain, injury, training, you name it, because I am about to say going, gone. So please do just drop me an email if you have if you are listening to this and thinking, oh my goodness, I wish I'd asked something, but otherwise I'll see you next week. I do them every single week. I just will share the information across different channels. So please just do come and join. And there we have it, another one just lost as I'm about to wrap up. Okay, so this question, I have what I think is bursitis in my hips. Any ideas on the best thing to do? I certainly do. Could you just advise me, Hannah, when you say bursitis in your hips, do you mean pain at the outside? So on the outside of the hips here. And you said hips, do you mean it on both sides? And could you also give me an indication as to when it came on, that sort of thing? And then we've got another question. I'll come back to yours, Hannah, when you've answered those questions. So Hannah, can you let me know, is it both sides? Where exactly on your hips? How long you've had it? What brought it on? And then in the meantime, I'll answer this question about what would be the ideal treatment for high hamstring tendinopathy. So high hamstring tendinopathy, I presume that you're talking about pain in your buttocks. So your hamstring muscles start in the ischial tuberosities of your sit bones. If you're sitting and you wiggle your bottom from side to side, it's those bony bits that you can feel. And the best thing for it is a loading program. Now, I would strongly recommend, I mean, you've used the correct terminology, which makes me think you're either a physio or you have seen a physio who knows what they're talking about, because a tendinopathy is the new word for tendinitis. So a lot of people still call a tendinopathy a tendinitis, but because we now know it's not inflammatory, itis means inflammation of, so now we know it's not inflammatory, it's to do with structural changes, so changes in the collagen, nerves, blood supply inside the tendon. We know that therefore we don't treat it in the same way that we would an inflammatory condition, or an inflammatory issue. So instead of resting it and then icing it, that kind of thing, the best thing to do is to create, as I say, a progressive loading program. So it's really important, because the location of the pain in this part, although it's unusual, it can also be referring from other areas, for example, your back, your hip joint, and even there might be some bony involvement as well. So I am very hesitant to advise people to carry out a loading program unless they have absolutely got a definitive diagnosis of a tendinopathy, because if you load something that isn't a tendinopathy, you could make it worse. Anyway, presuming that you have had this very clearly defined tendinopathy, the first thing to do is to remove anything out of your day-to-day activities that involves hamstring stretching. So you need to stop. If you're doing static stretches, you need to stop stretching. You need to not do things like lying in bed on your laptop working with your legs stretched out, because that puts your hamstrings under a decent stretch. Or for example, if you're sitting in a chair, you don't want to be putting your leg up and like that. Likewise, depending on how irritable it is, you want to be taking the pressure off it so that you're not squashing it when you're sitting. So potentially creating some kind of modification in your chair, using cushions, etc., so that, as I say, you're not just sitting right bang on it, because that's not going to make it any better. Instead, what you need to be doing is static contractions, which will reduce the pain. So we know that by statically contracting the hamstrings, that can really reduce down the pain and the tendinopathy. And then from there, you can then build up in terms of what we call dynamic loading, in other words, movement. So you start with that nice static, and then you start to load it both eccentrically and concentrically. So we used to think that tendon management was all about eccentric loading, but now we know that it's probably a combination of both. And the most important thing is to make sure that it's relevant to what you do. So, for example, if you're a runner, you need to be making sure that you're doing your tendon loading in the range of motion that's required for running, i.e. with your hip quite straight. and if you're a trail runner, then you'll be needing to do a much larger range of motion. And then you start nice and slow, as I say, with those statics, and you build up to doing more dynamic stuff. But then with running, you're obviously also going to need to do faster sort of impact type work. And depending on how fast you run will indicate the kind of speed of exercises that you need to do. So it's really important to bear those things in mind. And anyone that's watching this who does have tendon issues, most of the people that I see that have seen lots of other physios, chiropractors, doctors, whatever, and then they come and see me, most of the time there's something about their program that isn't looking at the whole package, isn't looking at looking at your specific goals, the range of motion, the amount of load, and the speed that load is being applied. So all those things are super, super important. And then, of course, like I've said, I'm not sure if you've been watching this since the beginning, but then we really do need to look at zooming out and looking at the bigger picture as to why that particular part of your body is being overloaded, and perhaps making some improvements to your strength in, for example, your ankles or your lateral glutes, or wherever it is that we need to do some strength work, so that we're preventing the recurrence of that problem. Because if we just treat the local area, it'll just recur. So we need to look at that bigger picture. And last but not least, looking at your overall training program, depending on what you're doing. So looking at have you suddenly recently introduced hills, or have you suddenly increased your speed, and how we can manage your program so that you can achieve all the things that you want to do, but without creating pain and injury. And of course, please do go and reference the recovery video that I've banged on about quite a lot today. So go to the website, stick in recovery at the top there, and it'll ping up. And then some of the exercises that I've mentioned, once you do have a diagnosis, something like, for example, the waiter's bow exercise, that's a really good one to start with once you've done your static hamstring contractions. But please, do make sure that you do get that actually diagnosed, so that we know that we can rule out any kind of stress fractures or any other kind of causes of your pain. Okay, so back to your question, Hannah. I think is a bursitis in my hips. Any ideas on what to do? And then I'd asked you a few other questions, and the answer is yes in both. Unfortunately, one is worse than the other. And then the other information that you've given me is I haven't run for 7 weeks now, and I think it was aggravated by one hip being worse than the other. Now both hips hurt a lot. To sleep, go upstairs, slightly twist. Interesting that it's twisting. It's entirely possible that you've got bursitis, Hannah, in both hips, but it's more commonly one. It's interesting that you say that it started in one first and then moved across to the other. Yeah, maybe you were kind of then preferentially using the less sore one, but I think it's really important that we get a proper diagnosis. So pain on the outside of the hips, again, I feel like I've talked a lot about stress fractures today, but it can be where stress fractures manifest. It's unlikely. The most likely thing is, as you say, is that it's bursitis. Now, what is bursitis? Well, on the sides of the hip there, just underneath where the gluteus medius tendon or common tendon inserts into the side of the hip bone there, which is quite tender if you poke it. Underneath there's a little bursa. Now bursa are just little pockets of fluid that create a bit of reduce the friction between the tendon and the underlying bone. So you've got them all over your body where tendons, where there's a tendon, there's often a bursa, and some people have more or less or whatever. Anyway, so we used to get the diagnosis for sort of lateral hip pain always used to be very sort of it must be a bursa. And now we know that actually with that bursa, inflammation of the bursa, you also get a tendinopathy of the gluteus medius tendon. So all the stuff that I talked about, I'm not sure I think you did hear me talk about the tendons, Hannah, but about the hamstring tendon, all the stuff that I talked about with regard to the hamstring tendon applies to the gluteus medius tendon. So look up gluteus medius tendinopathy and you'll see what I mean. Please don't do things like clams or lying on your side doing what we call open change hip abduction. So anything where you're lying on your side, lifting your leg or doing those kind of things. Please don't do those things. They're most likely will make you worse, not better. But what I would recommend you do again is you start with the static contractions of the gluteus medius. So you're literally standing and you're thinking about twisting your knees out slightly, contracting your legs and turning them out, and then holding for about 6 seconds, repeating 6 times, and then doing that frequently throughout the day. You've also got to avoid, in the same way that with hamstrings, you want to avoid stretching your hamstrings. You want to also, with a gluteus medius tendinopathy, avoid things like crossing your legs, or anything where you're bringing your leg across your body. So just don't do those kind of stretches where you're bringing your leg across your body or taking your heel across and pushing across. So don't do any of those static. Sorry, Bob. Don't do any of those static stretches. And then once you have got a reduction in your pain levels, then you need to start to think about loading your gluteus medius a little bit more. So the wall ball series is really really great for that. And then the Running Man exercise as well. So go and check out the website, stick it in the search tool at the top there. But it's really important that you get a proper diagnosis, because if you go and do those exercises and there's something else going on that's got nothing to do with the tendon, as I say, it can make it worse. So it'll be a real pleasure to see you for a video consult. Lots of people, I'm not sure if you've been watching this in the beginning, but lots of people wonder how do physios do video consultations. Go and check out, we've got over 300 5-star reviews. So go onto the onto our Facebook page and just have a look there. It's a lot easier if you just look there rather than me banging on about what a video consultation involves. But anyway, then I would look at why it is that you started getting the problems in the first place. So you mentioned that, I wonder, I know you're a runner, but I wonder if you suddenly increased the load for some reason, or if perhaps there are other aspects of your training program that you've not been paying as much attention to as you would normally. So perhaps looking at things like your nutrition and your sleep and your stress management, those kind of things, which can be a bit challenging after a year of a global pandemic, to say the least, can't they? So look at that bigger package as well. So I hope that's been helpful. They do respond, tendons respond really, really well to physio. So, and as I say, bursitis being within that category as well. So yeah, please do get in touch. Let me know if that answers your question, Hannah, and if you've got any other questions. Right. Next question. Oh, that's lovely. I'm going to read it out because that's lovely, Tracy. Well, it's a bit embarrassing, but I'm going to say it anyway. You're brilliant. Loving your videos. I will be sending you an email over the next few weeks. Thanks for your expertise delivered in such a super friendly and easy to understand way. Blush, but also quite nice to show off. And that's really lovely, Tracy. It's my pleasure. And I'm glad you find the videos on YouTube so handy. Thank you for your lovely words. It means a lot to me. Okie doke. So Hannah, back to you. So you're waiting for an MRI scan. Oh, good. It's been from September, so hopefully it'll come back soon. You've been nodding away. Good. I'm glad that you found that useful. Just make sure the exercises are pain-free. As I say, with tendon exercises, when I'm seeing patients, and I don't know if any of my patients or people that have been patients are watching this in the past, but anyway, you'll know that I often give painful exercises and I'll say, make sure this exercise you're getting about a 3 out of 10 in pain. However, because I haven't seen you and I haven't been able to give you a clear diagnosis, it's really important that the exercises are pain-free and that any running that you do is pain-free, or any exercise, like anything, basically avoid pain. And when I say avoid pain, I don't mean take a load of painkillers and go for a run. Please don't do that. That would be really silly. Just follow what your body's telling you, basically. Okay, I'm going to wrap up soon. But it's been lovely to answer all your questions, and thank you for joining me, and I hope that you've found it helpful. I will put this up here until, there we go, so that people can see how to contact me, because often I've been told in the past, but Lucy, you didn't mention how to contact me. So anyway, if I've banged on about that too much, then that's because often people ask me, you never said how to get in touch. Anyways, there we go. I hope that's been helpful. I wish you all a very, very lovely weekend. I can still see there's quite a few people watching, so but it is coming up to 2:30. So please do come and join next week. Drop me messages in advance. If you can't make it for 1:30, then just send me messages in advance. If you know people that can't make it at 1:30, send me messages in advance, and I am happy to then answer the questions live, and then you can watch the playback afterwards. So you can spread the word on that one. Have a lovely weekend, everyone, and thank you very much indeed for joining this Friday's Physio Q&A. Take care. Bye.